Well, I'm here to announce the Hawaii Department of Health has confirmed our first reported case infected with the Omicron variant strain of SARS-CoV-2 in a Milwaukee resident. On Monday, November 29th, DOH received notification from Diagnostic Laboratory Services of a specimen which showed a molecular clue that might point to Omicron. DLS immediately forwarded the specimen to the State Laboratories Division, and our laboratorians were able to start sequencing the specimen. We were able to use a new sequencing platform that returned results within days, even faster than we've been able to receive them in the past, making it possible for us to identify this as Omicron today. On the epi side, investigation of the case had begun when we first received the report of a positive COVID test before we were even aware of the molecular clue. So we were able to establish a few facts very quickly. The case was not vaccinated and had been previously infected with SARS-CoV-2 over a year ago. There was no travel history outside the state, signifying that community transmission of Omicron strain has already occurred in Hawaii. We are currently still investigating the case to identify contacts and provide appropriate quarantine guidance. So a few things for those of you who have been following the Omicron news, this may be familiar, but what are the reasons to be concerned about the strain? The variant was first identified in South Africa and brought to attention by South African scientists and epidemiologists because of a spike in cases they were seeing there, and then identifying this new strain through sequencing. Some of the concerns about this variant are that it could potentially break through vaccine and natural infection, higher natural infection. So there's still a lot to be learned about this variant, a lot of unknowns, but we are watching it closely. And of course, identifying our first case here in the state is something that we have a lot of attention on. Now, the bottom line in terms of public prevention measures, they are essentially unchanged. So while the variant is something we will definitely want to watch and track, we still anticipate that vaccination is going to be one of the best ways to slow transmission, whether it's getting the first dose or being boosted against COVID-19. And it's still going to be really important to wear your mask, practice mitigation strategies like maintaining distance as much as you can, and staying home when you're sick. Yeah, my assumption is it did get here through travel, if not through this individual, then through some contact and contact with a contact. So somewhere along the chain, we had a traveler come here, presumably, who brought this strain in. That is how most of them, well, to my knowledge, all of the new strains that we've seen in Hawaii have come from outside. I'm not aware of any that originated here in the state. What we're hearing from our colleagues in South Africa, anecdotally, is the epidemiologic situation there was an outbreak, started with an outbreak on a university campus. Now, that's relatively young, healthy people, but the people that were getting infected with Omicron there have mostly had milder symptoms, not very severe. It is too soon to say, though, whether that's what we're going to see in other scenarios or if that was specific to that outbreak. So as I said, still really a lot to be learned about this new variant.